Welcome to Learning Thursdays. I'm Dean Hale with the OASAS Learning and Development Unit and your host for today's presentation. Today's presentation is titled Data-Driven Insights on Gambling Harms in New York State. And my guests are Ashley Jordan, Director of Research and Program Evaluation, and Rebecca Cooper, Director of the Bureau of Gambling, Health, and Support Services for New York State OASAS. They'll join me in a moment, but first a word about Learning Thursdays. Learning Thursdays are offered to behavioral health professionals as a free learning opportunity with the goal of improving the knowledge and skills of the New York State substance use disorder workforce as we strive to improve the lives of individuals needing prevention, treatment, recovery, and harm reduction services. A goal of Learning Thursdays is to support the professional development of the treatment, prevention, recovery, and harm reduction workforce. We do this by offering regular presentations that are relevant to today's substance use disorder treatment professional. As always, if there are any questions, comments, or suggestions, please feel free to contact us at the Learning Thursdays mailbox. You can use the same mailbox to express an interest in providing a future Learning Thursdays program. And now it's time to start the presentation and welcome our guests.
So I am happy to be with you all today, and thank you for joining us on at least what's a beautiful day in New York City, to have our learning collaborative on problem gambling, and then today's focus on data-driven insights on gambling harms. So this is the second learning collaborative of 2025, and today's program is really going to focus on how we use data to inform our work, especially how we're looking to expand access to services and allocate funding. So this is what we do, across the agency, across the field, and certainly are applying it here specifically to gambling. I also just want to note and super proud of the work that's happening at OASAS. We just released our 5th and 6th addiction data bulletin, and those both number 5 and number 6 focus on gambling. And so one addiction data bulletin number 5 is on the gambling risk environment and perceptions of gambling, and then the addiction data bulletin number 6 is gambling harms and gambling disorder services and treatment. So please take a look. And I think in this talk, you're going to hear more about them. And I think you'll also get a QR code or a link to those. But please take a look at them. It's we really proud of this work, really trying to make data transparent and usable, and so it can help us and help you as we try to improve our services for New Yorkers. I hope you've all also seen our public awareness campaign that focuses on gambling called Take a Pause. So we launched it during NFL playoffs earlier in 2025, then through the Super Bowl, then through March Madness, and we are continuing that as we are getting into horse racing season and baseball season. So the campaign focuses on those who do bet and encourages them to come to our website to take a self-assessment on their gambling behaviors, to then give them feedback about the risks of developing harms related to gambling, and then, of course, resources. So that public awareness campaign has already been very popular. We can see who's coming to our website and who's taking the self-assessment, and we are going to be talking about some of those data during this meeting. So I also want to point out, we really important in our work is the collaboration across the state and across entities, and so that's including our collaboration with the Gaming Commission, and really, leveraging the data from the industry, in addition to the New York Racing Association and their work in terms of the horse racing and gambling. And so over the summer, we're going to be present at the Saratoga racetrack. So, going out into the field and meeting people where they are. So I want to thank Ashley Jordan and Rebecca Cooper and her team for their work in this whole area and for today's learning collaborative. And also just want to let you know that we have also renamed our Bureau of Problem Gambling so that it's now the Bureau of Gambling Health and Support Services. So really to focus more on a public health approach and really also focus on not stigmatizing gambling behaviors. So we're happy about that. And then I just want to say as well that there's a lot of free resources and technical assistance that is available. So free trainings about gambling harms, definitely support to obtain a designation on your operating certificate for gambling. And we also have marketing materials as well and public awareness materials related to gambling harms. So we're here to support you all, again, so that we can continue to provide the best services possible to New Yorkers. So again, thank you for your participation today. And I am very excited about the work that we're doing in this space of gambling. I think we are, in a lot of ways, leading the country because there are many states that aren't doing much. But this is, I think, a really important part of our portfolio that is not going anywhere, but only growing. So with that, I am going to turn it over to Ashley Jordan and Rebecca Cooper.
Thank you, Commissioner. Thanks, everyone, for being here today. My name is, I'm Dr. Ashley Jordan. I'm the Director of Research and Program Evaluation at New York State OASAS, and I'll be starting the presentation off, but Rebecca, if you want to introduce yourself before I jump in.
Sure, thank you. I'm Rebecca Cooper, and I am the Director of the newly named Bureau of Gambling Health and Support Services. And I just also want to acknowledge my team and my Bureau, Jen Farrell and Shauna Black and Tracy Stickle, who we all work collaboratively to expand the services and provide as much support as possible as we can to you guys in the field.
Okay, so the Learning Collaborative today focuses on gambling. This is the agenda. I'll present the definitions of gambling harms, gambling disorder, including how both are assessed and diagnosed respectively, so that we start on the same page. We'll present then what we refer to as the gambling risk environment. This provides a really helpful way to understand factors that may contribute to risk for gambling harms, and this includes also discussion of the oversight of gambling activities and services in the state. Following this, we'll present on the services and treatment that New York State OASAS provides for those experiencing gambling harms and gambling disorder, some recent survey data from New Yorkers regarding gambling, and then end with recent trends in the utilization of services and treatment for gambling harms. So by gambling harms, we mean negative consequences associated with gambling behaviors. This is with or without the presence of gambling disorder. Being at risk for gambling disorders means experiencing harms due to gambling that are associated with gambling disorder, such as financial problems, interpersonal difficulties, and we'll get into this in more detail in a couple of slides. But with respect to risk for gambling disorder, how is it assessed? It's assessed by using the Problem Gambling Severity Index. This is a very standard assessment to, again, assess the risk for developing gambling disorder among people who are gambling. It's a brief 9-item self-report measure, gambling behaviors, and just an important note that the components of this index are not the diagnostic criteria for gambling disorder. It's a slightly different index, and this index identifies risk for gambling disorder at 4 levels. Identifying non-problem gambling, low levels of problems with fewer or no identified negative consequences, a moderate level of problems leading to some negative consequences, and problem gambling with negative consequences or a possible loss of control. So gambling disorder, on the other hand, is a diagnosis, and it's defined as persistent and reoccurring patterns of problem gambling behavior leading to significant distress or impairment in a 12-month period. And gambling disorder is diagnosed using DSM criteria. The diagnostic criteria are listed here, and to have a diagnosis, at least 4 of the 9 criteria must be met in a 12-month period. And gambling disorder is diagnosed at 3 levels. For those meeting 4 to 5 criteria, gambling disorder is diagnosed as mild. 6 to 7 criteria met, gambling disorder is diagnosed as moderate, and 8 to 9 criteria met, gambling disorder is diagnosed as severe. So we'll discuss now the gambling risk environment. So a risk environment is a framework that promotes an understanding of harm as a matter of what's called contingent causation, which basically just means that harms experienced by individuals are contingent upon interactions between individuals and different environments. And so here, kind of environments, in quotes, refers to sets of factors in these 4 main buckets. And so the first bucket is kind of what we refer to as the policy environment. And these are policies that impact the availability of, access to, and legal status of gambling activities. The physical environment, which refers to numbers, distributions, aspects of gambling that increase the addictive potential of gambling. The social environment, which refers to social norms regarding gambling behaviors and perceived harms of gambling, media representation, exposure to advertising, and then the economic or resource environment. So the availability of and access to services for gambling harms and gambling disorder. And so these are also kind of the 4 domains for which we think of and are able to measure the impact of gambling on outcomes. And so just a couple of examples of data that you'll see today that relate to these domains are examples highlighting the legalization of mobile sports betting as a policy environment factor, numbers and types of gambling activities as a physical environment factor, public perceptions of gambling harms, tying to the social environment, and then resources to reduce harms due to gambling as part of the resource environment. So policies regarding legality, availability, access to gambling are some of the components of the gambling risk environment, as we just mentioned. And this context really matters when interpreting data. When we see trends of utilization of services to address gambling harms going up, it isn't always that the data speak for themselves. There's context that matters there, particularly as you'll see in later slides with the legalization and implementing of mobile sports betting in 2021 to 22. So legalized gambling has existed in New York State for decades. In 2013, the New York State Constitution was amended to permit the establishment of commercial casinos. In the 10 years that followed, since commercial casino legalization, there's been a rapid expansion in the number and range of gambling establishments and operators. This includes an increase in the number of off-track betting corporations from 5 to 10, and in the number of casinos to include 4 state-owned commercial casinos, in addition to 3 tribal casinos. New York State currently has more types of legal gambling activities than any other state, including New Jersey and Nevada. And with the anticipated licensing of 3 new downstate casinos in 2025, we're really looking at a potential increase, a major increase in the availability of gambling even further. So at present, there's no source of U.S. federal funding for services to address gambling harms or gambling disorder at the state level. This includes no funding for public health or monitoring of gambling trends or conducting research on gambling harms. The funding for addressing gambling harms and gambling disorder really comes exclusively from New York State. It comes through the New York State General Fund and from gambling revenue. And really the lack of funding and oversight from the federal level has really resulted in a paucity of information on the impact of gambling on health and social outcomes. Although we do know some, and there's clear patterns, and there is available data, it's really led to kind of a less of an understanding than we would like to have. So One important note that I did want to make in the context of the state oversight, New York State did recently change Medicaid policies to expand reimbursement for treating gambling disorder, which now permits reimbursement for gambling disorder with or without co-occurring substance use disorder. That hadn't always been the case, and so that's a kind of a really excellent, excellent like new thing. And again, all of the things that I just mentioned are examples of what one would refer to as the economic or resource environment. So all of these things related to decreasing or increasing potential harms due to gambling. So we have found success in applying a strategic prevention framework in our OASAS prevention programming, specifically supporting limiting or reducing access and availability. However, kind of one of the distinct differences we face with the expansion of gambling opportunities is that with mobile sports betting, now gambling is available 24/7 with no need to go anywhere except your phone. And so this is a map of the New York State with physical locations of the brick and mortar establishments enumerated. And again, kind of access and availability made much more complex by the fact that mobile sports betting is, essentially omnipresent. Okay, so what we do know about the impact of gambling on health and well-being, it's clear that the adverse impacts are more substantial than previously understood. Gambling harms, including gambling disorder, we know are associated with serious and long-lasting consequences. Financial consequences can include debt, asset loss, bankruptcy, the social consequences, loss of trust, interpersonal conflict. And the health consequences can include, development of gambling disorder, as we previously discussed, but also higher prevalence of anxiety, depression, insomnia, substance use disorder, suicidal ideation and attempts are seen among those who gamble compared to those who don't. Further, we do know that gambling harms can occur among people who don't develop or have gambling disorder, and this is an important thing to note. And as we see with substance use, gambling harms are also experienced by significant others. Estimates are that for every one person that is experiencing gambling harms, at least 6 people close to that person experience harms as a result. And so while anyone who gambles is potentially at risk for experiencing gambling harms, there is emerging evidence of what's referred to as a gambling harms paradox, specifically that groups, there may be groups as likely or even less likely to gamble than others, but are more likely to experience harms if they do gamble. And so this is kind of really tied to those groups being more likely to experience harms related to gambling due to social and economic determinants of health. And the data do point to higher prevalence of gambling harms occurring among those residing in under-resourced areas, identifying as non-Hispanic, Black, Native American, or Asian, lower income earners, people with lower educational attainment, those unemployed, and those experiencing substance use disorder. So in New York State, there's two government agencies that really oversee gambling and gambling services. The Gaming Commission really regulates and oversees all legal gambling activities in the state. This is the lottery, gaming, horse racing, what we refer to as charitable gaming, bingo, raffles, whereas New York State Office of Services, Addiction Services and Supports oversees the system of services for those affected by gambling harms. And we'll talk more about the continuum of services, but it spans prevention, treatment, harm reduction, and recovery. I did also want to mention that in addition to the government agency partnership, the Responsible Play Partnership is a very important collaboration between OASAS, the Gaming Commission, and the New York Council on Problem Gambling. And now this partnership really works together on preventing underage gambling, bridging partnerships between local providers, gambling facilities, ensuring compliance with New York Gaming Commission rules and regulations, and then also providing access to services for those experiencing gambling harms. We also importantly partner with regional and national partners listed here, including the National Council on Problem Gambling. So I'll turn it over to Rebecca to discuss the Continuum of Services.
So I'm just going to talk briefly about the actual services that we provide at OASAS for those experiencing gambling harm. But as the Commissioner talked about in her opening remarks, one of the things that we have done is change the name of our bureau. And, we used to be the Bureau of Problem Gambling. And as we're moving towards, really looking at the data and expanding services and really sort of honing in on the practice, we see that language of problem gambling that can be very stigmatizing. So we have changed the name of our bureau to the Bureau of Gambling Health and Support Services. And, within our bureau, we really oversee all of the support services, that all of you provide. And we also work very, very closely with Ashley's bureau and many other bureaus across the agency, which has been a really great collaborative effort. And it's one of the reasons we're able to start presenting some really great data and information that's really helping us be very mindful about how we are going about providing services and workforce development, and really what the impacts are on the multitude of availability and accessibility of gambling in the state. So this is just really a overarching overview of the continuum of services. Obviously that most of you know this continuum of services of care that we have for substance use, and we just wanted to highlight a little bit of some of the specifics for gambling prevention and gambling treatment and recovery and harm reduction, just to give a framework for that service delivery. And I do see a lot of you on the call who already provide services specifically for gambling, and so thank you, and we certainly appreciate that. And we do strongly encourage you that our treatment providers to think about looking to add that to the suite of services that you provide, and we'll talk a little bit more about that in a minute. But from a prevention standpoint, we do some community-based training and events. A lot of this is done through our partnership with the Problem Gambling Resource Centers in raising the awareness as a first step. And as Ashley noted, where the funding is for prevention, because there's no federal funding for prevention services or for gambling services, the federal funding that we do get for prevention is we're not able to use that for specifically for gambling prevention. And so, that's another area that we're starting to look at, and how do we start to expand individualized prevention services in communities. But right now, all OASAS prevention providers are required to provide up to 5 community-based prevention programs every year to start that awareness and education building in their communities. From a treatment perspective, we have worked really hard over the last couple of years to continue to expand access and availability for services. Telehealth has definitely helped with that, as it has for all services that OASAS provides. But we currently have a network of 100 private practitioners that have been approved, and the New York Council on Problem Gambling and the Problem Gambling Resource Centers oversee that part of the service delivery, that are available to receive referrals from the Hope Line for those that are looking for treatment services. We have, actually, as of today, we have one more that was just designated today. So as of today, we have 45 outpatient gambling programs within our substance use outpatient programs that have a gambling designation on their operating certificate. And this is one of the areas of focus that we really concentrated on last year and into this year, into providing a lot of technical assistance and support to those treatment providers that are interested in engaging in this process. And there'll be more information at the end of this presentation for you to get more information on our website. If you're interested in that process, then you can reach out to your regional office, and we'll coordinate with them to give you more information if you're interested in that. And then we do have 11 ATCs, our addiction treatment centers, that also have gambling designations on their inpatient programs. And last year, one of the things that we did, which was based on feedback from those that had access inpatient services at our ATCs and from providers in the community and those that are providing services within our ATCs, is that it was really important for us to have some sort of designated ATCs for those that have a primary gambling use disorder diagnosis, that they're all going to one or two ATCs to be able to provide a better person-centered care approach, because one of the things that we are finding is a lot of times someone that has a gambling-only use disorder in an inpatient program out in Buffalo, there might be one there, and there might be one in Utica, and there might be one in one of our downstate programs, and so we really wanted to try and provide a better person-centered care approach. So in the fall of last year, my days are all mixed up now. My years are all mixed up. So we designated McPike ATC in Utica and the Bronx ATC. And so those are two ATCs that for those that have a primary gambling use disorder, they may not have a co-occurring substance use, that we're offering them to go to one of those two so that they would be sort of within the service delivery of people that have a gambling-only disorder to do that. So we're excited about that, and hopefully that would sort of help us provide more person-centered care. From a harm reduction standpoint, the commissioner talked about our Take a Pause campaign. It's one of the a very big campaign that we launched in January, and it will continue to run throughout the year. And one of the things I think that's really great about this campaign is that, and Ashley talked a little bit about it, is that it's really targeted towards those that are currently gambling, maybe not necessarily problematically, but they may also not even know or what that means or what the warning signs are or what they should be thinking about. And so we did, there is a quick survey. It takes, I think, 30 seconds with the Problem Gambling Severity Index for them to take. And then it gives them immediate normative feedback on their current gambling behaviors and where they are on sort of that risk level continuum that Ashley talked about, and then gives them feedback on, either how to sort of stay in that recreational lane, or if they're scoring a little bit higher, at higher risk, some other resources and supports that they can access. And I did see Mara Mendocino from Lexington, who's one of our very long-term outpatient gambling providers. She did put in the chat early on, and we're excited about this. And it is on the resources at the end, but I'll ask my staff to drop the direct link in the chat. We did launch GAMFIN in January, and that is a specific free service for anyone that's in the state that's experiencing financial challenges related to negative consequences of gambling. And we know that the financial consequences tend to be what brings even the issue to the surface or brings it out of sort of secretness, is when there is some kind of financial crisis. And so this is a program that's offered for free. It's a subcontract with an online provider that provides free financial counseling. And, we're excited about this. We've seen a sort of a big draw to that. One of the things that we decided to do for this is to be able to offer that to anyone that's affected by gambling harms in a financial way, regardless of whether or not they're involved in any other service related to gambling harms in the state. Because oftentimes, and I think this is just in general, when people are experiencing financial difficulties, it's really, really hard to focus on anything else. So you're trying to figure out how to put food on the table or pay the bills. And so that is a new free service, and obviously can be utilized from a harm reduction approach as well, to help people get their finances back on track. The people that provide that service also have been trained in the other continuum of care services that OASAS provides. So if the person is not involved in any other support services, and they decide that they may be interested in that, they're fully trained to be able to refer them and get them into additional supports. Voluntary self-exclusion, which Ashley's going to talk more about, and the data surrounding that. That's something that's overseen by the Gaming Commission, where people have the option to voluntarily self-exclude from gaming facilities in the state. And one of the things that we did really to enhance sort of that harm reduction approach too is on the form that people fill out for voluntary self-exclusion. They can now opt in to have a call back directly from the Hope Line to be able to help them access care and additional services if needed. And then the New York Council on Problem Gambling also provides an online support service to help people fill out the forms. Because it can be a little confusing if someone opts to have that fill out those forms when they're not at a local casino or facility. And then on our website and obviously in the treatment process too, we have lots of different strategies to support people on how to decrease the harms associated to gambling to prevent it from getting any worse for them. And then lastly, but certainly not the least, is our recovery services. So one of our big supports and projects is really looking at how do we incorporate gambling recovery supports into the OASAS suite of recovery services. And so we're in our second year. We've done some needs assessments in our existing recovery community outreach centers about what the best way to do that is and what that would look like. And so we're in the second year of that project where we're starting to implement gambling recovery supports within 8 of our RCOCs. And so we're really excited about that. That will sort of help expand those services, and then, down the line, hopefully be able to replicate that in other recovery support areas in addition to the RCOCs. We also, there currently is access to peer supports. And right now that is through the New York Council on Problem Gambling. That's a free service that anyone can access by calling the Problem Gambling Resource Centers. We also will be, incorporating peer supports within the suite of recovery services, and the Problem Gambling Resource Centers throughout the state are in the process of incorporating peer staff within all of their resource centers as well. And then the last piece I'll talk quickly about is that we have developed training for those that have lived experience with gambling harm to sort of start the training process and implementation of integrating peers into our workforce. And the first round of that training will be offered most likely probably the end of the summer, early fall. That will be free. And so we'll be doing some more launching of that, public awareness on that. We might even maybe do a training, just an informational training on that as well. So that's my quick overview, but it also, in sort of, we have a much better structure of this and sort of a direction, and a lot of that has been based on the data and information that we've been able to use to sort of help us sort of make sure that we're taking the right direction and where we're providing services and expanding that.
So thank you, Rebecca. So we'll now move into presenting some of the results from surveys we've done with New Yorkers about gambling. And I'll get to this at the end of this kind of data section, but these data presented today are some top-level points that are explained in greater detail in our addiction data bulletins that the Commissioner mentioned at the start of the Learning Collaborative today. So the two recent surveys we'll be presenting on today. The first was a survey that we did to kind of understand better the perceptions of New Yorkers on the harmfulness of legal gambling activities. And then the second survey is, as you've heard now, was the survey to assess risk for gambling disorder among those who currently gamble and who may be concerned about their gambling as part of the Take a Pause public awareness campaign. And I'll also talk about that in a little further detail with the data. So the first survey was conducted in September 2024 among a convenient sample of New Yorkers at the State Fair. The survey was assessed New Yorkers' perceptions of gambling harm, specifically how they perceived the harmfulness of a range of illegal gambling activities. And so for this survey, we had a total of 349 responses from residents of 37 counties. Of these, 15.2% reported personal experience of gambling harms themselves. So the legal gambling activities that most perceived as the least harmful were in the categories, the top two categories of lottery, scratch-offs, raffle, and bingo, and stock commodities markets. And this is in contrast to the gambling activities that most perceived as being the most harmful. And those are on the bottom, which is the categories of horse and other animal racing, and then casino games. To me and to us, what is kind of very interesting about these findings is, regardless of kind of like the distributions, a majority of respondents perceived any form of legal gambling to be somewhat harmful to harmful, so harmful in some way, and that's about 65% to 87%. And so that kind of, I think, is important and informs our work, but also kind of leads us to want to ask kind of more and additional questions. And so a lot of the data you'll see today is informing kind of our next steps, which I'll discuss briefly at the end. The second survey, as you heard, was part of the Take a Pause public awareness campaign. And so this relates to kind of a larger OASAS initiative. And so our agency has procured a 5-year contract for the development and promotion of a range of public awareness campaigns. This happens to be the first campaign we've launched. It's been promoted in various mediums, as the commissioner noted, during football and basketball playoffs, during championship games. And part of the awareness campaign has included New Yorkers to assess for risk of gambling disorder by completing the problem gambling survey. And you can access the survey via this QR code that's present here on the presentation, but is part of all of the marketing and the promotions for this initiative. So the survey results presented today were from the first quarter of the public awareness campaign, so January to March 2025. Again, this was a convenient sample of New Yorkers who had participating in gambling activities, so people actively gambling and who may be concerned about their gambling, with a kind of a focus on people who are engaged in mobile sports betting, just by virtue of kind of where we promoted the public awareness campaign. So in the first 3 months of the survey, we had 3,470 responses. And just wanted to highlight here that among those who reported gambling and who completed the survey, 65.2% reported experiencing consequences from gambling that may indicate that they're experiencing gambling harms or gambling disorder. And so just think that this is important, and we'll be, as kind of time goes on, we'll be updating these results and look forward to kind of sharing the trends in the survey reporting over time. So moving into the recent trends in the utilization of services and treatment for gambling harms. So there are 3 types of service and treatment data that we'll be presenting today. The first is helpline data, and the helpline is going to be the combination of calls received through the helpline and through our 7 problem gambling resource centers. But the helpline is a multilingual 24/7 confidential helpline providing on-demand crisis support and referrals. The data presented are volume of calls monthly and annually from 2020 to 2024. The voluntary self-exclusion program, which Rebecca mentioned previously, is the program in which individuals can voluntarily choose to effectively ban themselves from engaging in gambling at specific establishments or with mobile operators for 1 year, 3 years, 5 years, or for a lifetime. And this program is overseen by the Gaming Commission. And the data presented are volume of applications annually from 2017 to 2024. The third piece of data are the gambling disorder treatment data, and this is a combination of in and outpatient treatment. And the data are of unique individuals engaged in treatment from 2020 to 23. So the helpline data. So the volume of calls to the helpline range from 2,345 in 2020 to 3,064 in 2024. Over this time period, the volume of calls increased by 30.7%. The largest single year increase of 25.9% was between 2021 and 2022, with peak call volume in 2022. So in January 2022, as mentioned in the gambling legalization timeline, mobile sports betting was implemented in New York State. So we saw, at this time period, an increase in helpline calls. Also, in the helpline data, we do identify the top reason for calls to the helpline. And so for those calling for gambling harms, we found that, prior to 2022, the number one reason for calling was casino-based gambling concerns, but starting in 2022 and in each year since, the top reason for calling has been mobile sports betting. With respect to the voluntary self-exclusion program data, the annual volume of applications ranged from 980 in 2017 to 1,646 in 2023. So during this time period, the volume of applications increased 68%. Similar to the helpline annual call trends described on the previous slide, the largest single-year increase of 36% was between 2021 and 2022, with peak application volume in 2023. Further, the annual volume of the applications received for the one-year ban at any establishment or with any operator increased significantly more than any other duration, and that's compared to 3-year, 5-year, and lifetime bans. This pattern, we're looking more into these data, but this pattern, could suggest an increase in those who may be newly experiencing gambling harms or maybe using the voluntary self-exclusion program as like a time-limited harm reduction strategy. But again, exploring these data more and exploring more with our partners at the Gaming Commission. So with respect to the treatment data, so again, these treatment data are the combined trends for both inpatient and outpatient treatment. Between 2020 and 2023, the annual number of New Yorkers engaged in treatment with gambling disorder ranged from 3,535 to 5,173 in 2023, and this represents an increase of 46.3%. And similar to the helpline and voluntary self-exclusion data, the largest single-year increase of 22.4% was between 2021 and 2022. So in brief, we clearly see in the data in the utilization of services and treatment for gambling harms that the utilization has increased since at least 2020. The largest single-year increase for all presented service and treatment utilization data was observed to be between 2021 and 2022, following the implementation of legalized mobile sports betting. As of 2022, mobile sports betting surpassed casino gambling as the primary reason for gambling-related helpline calls made by New Yorkers. New York State collects and analyzes these data as a key part of our data-driven approach to meeting the needs of New Yorkers experiencing gambling harms. And we're building on these data to better understand the trends, particularly by socio-demographic groups, by New York State region, and really looking to maximize the use of these data to inform resource allocation and expansion of services. And so these are 2 addiction data bulletins that were launched, and they can be found on our website. There's kind of a mobile browser version, so you can kind of read them in full online, but you can also access the PDFs if you want to download them. They're like couple-page documents in color, and those are available on the website as well. And Rebecca, I'll turn it to you now to explain the last couple slides on resources available for folks.
Sure. And this is just a reminder, if you're not providing the service right now for gambling harms, and you have someone that's identified, how you can help them access support. Obviously, the Hope line, which is not just for those experiencing gambling harms, but substance use as well. And we have the online provider and program search that you can use. The QR code is there, and then the regional problem gambling resource centers. You can also call the one that's in your local region, and they also have access to all of the services that are available to help with the referral sources. And the next slide, I believe, this is more of resources for those of you that are treatment providers. we talked a little bit about obtaining a gambling designation on your operating certificate. If you're interested in more information, you can scan the QR code, or I believe there's the email we dropped in the chat. It'll give you more information. If you're interested, reach out to your regional office, and we'll connect with them and do what we can to support you in getting that application submitted. All OASAS outpatient 822 clinics are required to screen for gambling harms, and that QR code will bring you to that. We are in the process of updating that, and we'll sort of let you guys know when that happens. But this will give you the resources there. And then I'm actually kind of going backwards here. I see gambling clinical resources. This is also another page for treatment providers that give you lots of resources in providing the service and access to other things that might support the work that you're doing. All right, Ashley, I'll turn it over for discussion.
Yeah, so thanks. Yeah, so thanks everyone. So that's the end of the presentation. We did want to aim to have some time to discuss, answer any questions, but also, have a larger discussion. A lot of, these data are new. I think that, I know that, I'm interested, we're interested to hear your feedback, but also just generally kind of, leaving it open for open kind of question and answer. I also can't see the chat at all. So I don't know if someone can help. I don't know if there's questions embedded there.
I can see it, Ashley.
Okay.
So,
okay.
Emma is asking any youth prevention education programs yet. And Emma, are you referring to actually EBPs for, I don't know where you are, Emma. I don't know, Dean, if you can unmute her.
So I was just wondering if there was anything yet that was more than just a classroom one-off on this, because we actually put a question on mobile sports betting on our Bach Harrison PNA, and there was actually more. I mean, it was low, but it was more students that disclosed daily repeated betting than I thought they were going to.
Yeah. So I can tell you from the only EBP that's on the registry right now is called Stack Deck. And I believe it might be 5 or 6 sessions. And the curriculum really focuses on probability and chance and those kinds of things. So that is the only one really that is evidence-based right now. But you're in Saratoga, right, Emma? Is that right? Are you in Saratoga? No.
We're in the Adirondacks.
Adirondacks, okay. But we're happy to talk more with you about that. It is something that is on our radar, and we work very closely with the Division of Prevention, and that's sort of where we're looking at right now on how we can expand that and what we can do, because we do know, obviously, one of our highest risk populations is the 18 to 24-year-olds, which obviously means they're gambling way before that age. And the accessibility and availability obviously has expanded. So it's a great question, but right now, Stack Deck is the only one that's on the registry as an EBP. So Olivia is asking, could some of the increase of service use, helpline, and voluntary self-exclusion program be due to increased awareness of the services? Not sure if that is something you're looking into.
Yeah, I think definitely. I think the ways that, we're kind of expanding awareness of services, expanding the availability, and just kind of the range of services could also kind of contribute to increases and then people engaging. So it's not exactly a measure of, let's say, like prevalence of harms or prevalence of gambling disorder, but most certainly would point to kind of making more services available, both like awareness and also in actual services.
Yeah. And one of the things that I'll add to that, especially on the treatment end, is as more and more providers obviously are doing sort of an initial screening, one of the things that we know, especially those that are accessing care that have substance use challenge, is oftentimes that's not why they're coming into an outpatient program. They're coming in for a substance use challenge. And so oftentimes when they're screened at the beginning, you know, they're really sort of not paying attention to that or aren't aware that it could be a problem. And some providers are starting to rescreen after they sort of have been in treatment for a while. So, the ATCs, the inpatient providers for the ATCs have done a great job, and we thank them for that. So we have seen an increase in utilization in the inpatient programs as well. And the other thing that I will add to the direct correlation that Ashley is talking about, which we can't necessarily measure for the increases, is one of the next campaigns that we're working on is a campaign that's targeted to those that currently have a problem, and the message and the call to action, if you will be to call the Hope line directly. And I think from a data perspective, as that campaign launches, we might be able to, you know, have a little bit more of a comparable measure if there's a direct impact. But I do think overall, and we certainly are appreciative of the commissioner making this a priority as this has become a priority, and we've done more focusing in lots of different ways that, you know, will hopefully continue to see those increases. Because we know people are out there that are experiencing challenges right now, but the access to care hopefully will slowly continue to increase. Mara,
Yes, Mara.
have your hand up. Yeah.
Actual hand raised. I love that.
A little old school.
I
have
love
a question. I did
that.
put it in the chat. So some of my newer clients wanted to exclude themselves, and so they had said, "Oh, I have to go to my bank and get it notarized," and I feel so uncomfortable. So I'm like, I don't think that could be right. So obviously, I went on the website and I looked it up, and I'm like, I don't know if that's sort of us.
Yeah, so I'm glad you brought that up, Mara, because I think when we talk about barriers, that's a big one. I think it's a two-answer question. The first one is it's a requirement through the Gaming Commission that it has to be notarized. And it's a challenge. It's something that's always on the topic of discussion in the work that we do with them through the RPP, because it's definitely a barrier that it has to be notarized. And the secondary piece that I will say to that is one of the things that the New York Council on Problem Gambling has done is to develop an online VSC support program, and some of their staff are notarized. And so if you come across someone that is interested in self-excluding, the other challenge, right, with self-excluding is you either do it on your own and get it notarized, like you're saying, and put it in the mail, or you have to walk into the casino and get on the floor, which really is, not very sort of person-centered. And so that is another resource that people can contact their Problem Gambling Resource Center, or clinicians can do that as well, and connect them. And they have people that are notarized that can do the notary with them online. They can do it as part of the clinical process. And so that's just another additional resource that we've added on to sort of break down some of the barriers related to the self-exclusion.
Thank you. Thank you.
All right. I don't see any other hands up, and I don't see any other questions in the chat. Let me just double check. I think that's it. All right. Well, thank you everyone for attending. And Dean did put the information in the chat if you're interested in getting continuing education hours, going to Answer Key and filling out the survey. And you'll be able to get credit hours for that. And stay tuned. We plan to continue to do these learning collaboratives on an ongoing basis, and we appreciate you attending.
Thank you. Thanks, everyone.
I want to thank our guests for joining me today. I hope you all find it useful while assisting clients in need of services. Your feedback is important to us. It helps us to know if we're meeting your educational goals and expectations. Once you have viewed the presentation in its entirety and completed the quiz, if prompted, please follow directions to access the SurveyMonkey website and take a moment to complete the evaluation, including any suggestions for future topics for Learning Thursdays. Once again, thank you for joining us, and keep up the good work.